CDC says it is reviewing the mask guidelines and will be updating them soon. So what should that update look like for kids? Dr. Janine Noble, an associate professor of emergency medicine and the director of COVID response at the University of California, San Francisco Emergency Department, joins us now, along with Amna Husain, a pediatrician. Good evening, ladies.
Good evening.
Hi, good
Thanks
evening.
for having us.
So you both have different perspectives on this issue. And Dr. Noble, you told me last week that if anyone is going to unmask, we should let our children go first. And now is the time to get rid of mask mandates for kids in school. Why do you believe that?
Yes, kids are at the very lowest risk from serious health consequences or death from COVID compared to our wider population. They've also endured the longest period of social isolation. In many states, schools were closed for a full 18 months during 2020 and 2021. So as we lift these risk mitigation layers, masking being the prominent one that we're discussing now, kids should really be first in line. They are the least threatened by COVID illness, and they have the most to lose from perpetual masking in their educational environments, trying to understand nuanced speech, read facial emotions. And we have a lot of kids who are learning English as a second language. In fact, 5 million of them in the United States, another 4 million kids who have some sort of language delay. Keeping them masked and their teachers masked is really putting enormous barriers in their path to catching up and getting where they need to go from an educational standpoint.
Dr. Husain, you were on the other side of this issue. Why do you think kids in school should stay masked?
Sure, and I completely understand Dr. Noble's standpoint. I am a mother of 2 children who are not yet vaccine eligible, 4 and 8 months old. And I understand just how much fear, overwhelm, anxiety, and frustration is out there. But what I worry about is just losing these important public health safety measures in the home stretch. We are so close to being able to provide some kind of vaccination and protection to our youngest population. But right now is not the time. We know that we are just overcoming barely a surge right now. And Omicron has shown us 3 times the peak of what the cases were during Delta amongst children. The latest morbidity mortality weekly report from the CDC actually shows that children have hospitalizations 4 times higher right now during Omicron. Highest cases of positivity are actually amongst children 0 to 4 years of age, not yet vaccine eligible, and 6 times higher rates of hospitalization among adolescents who are not yet vaccinated. I completely agree that we need to keep schools open. They are more than just an academic institution. They provide social skills, emotional skills, safety, support, nutrition, health, activity, so many things for children. But one thing that we do know is that masking allows schools to actually stay open in a safe way with these important mitigation measures in place. We know that you are much less likely to actually test positive if you wear them.
So what do you say to that, Dr. Noble? The point that Dr. Husain makes that, look, when you look at the hospitalizations, a lot of these are the kids that are under the age 5, and they're not yet eligible for vaccines. And so they should, wear masks to provide that protection. What do you say to that?
So we have to take these risks in context, and for parents to really make decisions and navigate these difficult times, they need to know what these COVID risks are compared to risks that they're used to navigating with their kids. So an unvaccinated 5-year-old has the same risk of a serious outcome from COVID as a vaccinated 50-year-old. Our parents have sent their young ones to school without masks, without testing and quarantine in RSV season. RSV, the virus that causes a frequent respiratory infection in little ones, as well as flu. And so these comparative numbers, I think, will be really reassuring to parents. So in a typical RSV season, between 100 and 500 kids under the age of 5 die every year. For COVID, for the 2 years that we've had COVID with us, 307 children under the age of 5 have died during those 2 years. That's, an annualized death rate of 150 kids dying per year, which is on the low end when you compare it to RSV. And when you compare it to flu, the data is similar. So for our 2019 flu season, we had 347 kids under the age of 5 die of flu. And again, 307 have died of COVID in the past 2 years. So flu was actually a greater threat in terms of of death for kids in 2019. So parents need to be aware of these numbers. It's very hard to know what the real risk is when we just report, gosh, thousands of kids are in the hospital, but compared to what? And the risk that young kids face from COVID is very similar to the risk that they have historically faced from other respiratory viruses. And then the second piece of this is that do masks really reduce the risk of transmission in schools? And in order to know what masks do, we need high quality evidence. And that in medicine, we call a randomized controlled trial. We only have one of those for masks during the time of COVID, and only in adults. It was done in Bangladesh. And it found a very modest risk reduction for adults over the age of 50 who wore a surgical mask, no benefit at all for cloth masks. And the real risk reduction was probably somewhere around the order of 1%. So in this post-vaccination era, where we have our highest risk individuals with free access to vaccines, and kids who are much lower risk, even when they're unvaccinated and have so much to lose from perpetual masking, the time has really come to urgently get them back to normal and let them unmask.
And Dr. Husain, I'm going to give you the time to respond to that. In terms of the studies on the CDC website, there are a lot of different studies. I see your point, Dr. Noble, that they should be of a certain quality, but the CDC, and I encourage everyone who's interested in this to check out what the CDC has in terms of studies, including those impacting school-age children in schools with mask mandates and without. But Dr. Husain, you just heard Dr. Noble make the case that, look, during flu season, before all of this, kids didn't have to mask up at school, and that arguably the flu is more of a risk to kids than COVID is. So why should they be wearing masks now? What do you say to that?
Yeah, if I may, with pediatricians, we see a lot of flu. And actually, COVID-19 is not at all like the flu. Yes, both affect the upper respiratory tract, but let's actually talk numbers here. So typically 150 to 200 children and teens die of flu per year. Now, just in November of 2021, we had 745 children dead from COVID-19. Now look at us. In almost February, we're at almost 1,000. We have 970 children dead. So at the span of 3 to 4 months from November to now in February, you've had almost 300 children pass away from COVID-19. Not to mention, one thing, it's not just about mortality, because I know a lot of people say it's just the cold, it's just a cold. It's not just about mortality, it's also about long COVID, MIS-C. And just like we've talked about schools staying open, there's stressors about schools closing. Not to mention, one thing that I try to teach my children is make sure you take care of others as well. So whereas your child might do well with COVID-19 and it might be a mild cold, we can't say the same about those immunocompromised children or elderly citizens out there. So this is, again, a public health issue at the forefront. So COVID-19 is not like the flu. It's not. And there is a vaccine out there for flu for children 6 months of age, as young as children 6 months of age, that we know decreases risks of transmission and decreases severity of infection. I don't love that my children have to wear masks, and this is almost all they know as well. But I will continue to do what I can to protect them and protect those around them. And when it comes to the quality of masks, you're right, Pam. There is a CDC morbidity and mortality weekly reports that shows a beautiful infographic that shows no mask, cloth mask, surgical mask, and then the highest quality N95 mask and the protection it can afford you. And it's an 80% lower risk of testing positive. So I have my children in a high quality KF94 mask right now, because again, I want to try to keep them protected, but those around them. Now, when it comes down to, does this affect our children? I'm not going to lightly sugarcoat it. It does. This pandemic has caused micro and macro tears in the society, the fabric of our society, and it's going to take a long time to recover. But one thing I know for sure, as an expert in pediatric medicine and children, is that children are resilient, and they absolutely feed off our attitude. So when we tell them that these measures are important to keep them safe, then they will continue to do what they can to protect themselves and protect others. Another thing I know.
Go ahead. Quickly, it's okay. I know we're all passionate about this. Go ahead.
Another really important thing to know is that by getting rid of masks doesn't make the pandemic go away. It's actually the other way around. Trying to solve the pandemic will eventually make masks go away. Just because you have a cut doesn't mean that the Band-Aid is the thing that hurts it. It's actually the pain of the cut. So we know that doing these important measures can keep schools open and keep our kids safe.
All right, Dr. Husain, Dr. Noble, that was a civil discussion, a great discussion, a lot of important information for parents to consider. We'll be right back.